So in the United States alone, approximately 29 million women are affected by severe intimate partner violence. So this includes sexual, physical assault, along with rape, etc. However, about 57 million are affected by psychological aggression, which we don't often hear about, and also about 37 are affected by less severe intimate partner violence. So that includes like pushing or shoving. So in that sense, a lot of research actually focuses in terms of intimate partner violence on severe violence, and very limited research actually addresses this lower level violence or situational violence, such as physical or even insults, humiliation, and that aspect of it. So in 1998, Heiss introduced this model in examining intimate partner violence. So traditionally, research in the past has focused on intimate partner violence looking at individual level risk factors, which often revolves around whether or not, for instance, a person grew up in a family and witnessed intimate partner violence, if the person is using drugs, alcohol, abuse, so very micro and individual level characteristics. So Heiss introduces this model where she says that intimate partner violence needs to be examined through different levels of society, that all these levels are kind of playing a role together. So she starts with the individual level characteristic, and that's where your personal history, the individual level characteristics that I was talking about earlier, and then moving on to more community, close social networks, so your friends, your family, and then more community level, where you live, what's going on in the community, your social networks, social norms within the community, and what's going on within the community. And finally, the macro level. And this macro level introduces aspects of society where there's norms, just social structures, and how these may reinforce gender roles and gender ideals. So with this in mind, we started looking into religion as a social institution that plays a very important role in the lives of many Americans. In 2007, Pew reported that over approximately 80% of Americans reported belonging to some religious group. So from there, we kind of went into this concept of religiosity and how religiosity may affect IPV. So our hypothesis was that if religion and religiosity provides social network, then it should have an inverse effect with IPV. So using the Portraits of American Life study, the first wave of the Portrait of American Life study, we examined the effect of intimate partner violence by religiosity. And for those of you who are interested in the research, my poster is right back here, and I would love to talk to you about it. Thank you.